pass it, but he's going to explain it. Okay. All right, we have a quorum. I'll call the meeting to order. Ah, are you in the wrong room? Or what bill would you like, sir? Come on, pick a bill. Well, you never come to this committee. I'd be honored to pass a bill for you. Yes, I'm sure you can. You're welcome, sir. Okay, let me call for House Resolution 1254. Representative Stevens, would you like to present your resolution, please, sir? And we're working off LC 109-0192. Everybody has that. LC 109-0192. Okay.
Good afternoon, Madam Chairman, and thank you for hearing this resolution. All this resolution does is send a message to the Medicaid care management organizations, and what we're asking that they don't overlook the fact that we have about 7,000 Medicaid patients who are ADH, and these are teenagers for the most part, and that we want them to continue to be able to take their medicine by advance. And I'm asking Ms. Amy Hughes to come up and give us some technical information on this.
Okay.
There. Good afternoon, Madam Chairman and committee members. Thank you so much for having me. I'm Amy Hughes from Savannah, Georgia, with Hughes Public Affairs, and one of my clients is Shire, who manufactures the drug, the ADHD medication Vyvanse. Y'all have already had an extensive hearing about the subject, so I'm not going to rehash any of this. As Mickey said, that this resolution simply sends a message back to the Medicaid care management organizations that, as the chairman said, you are paying attention, and when they take actions that cut 7,000 children off of their medication and then forces them to go through a process where they have to fail out on 2 other medications in order to get back to the drug that was working for them to begin with, that's just not acceptable. That these kids need every opportunity to be successful in school, and if a drug can help them be that way, then they should have the access to it. I'm glad to answer any questions, but otherwise, thank you very much.
Thank you. Questions for the representative or Ms. Hughes? Okay. Representative Gordon.
Thank you, Madam Chair. I just want to thank my seatmate for bringing this opportunity to us, and Mrs. Hughes for educating us. I think via hearing we had a chance to just hear both sides, and I just think this resolution is the right thing to do. Hopefully it sends a message that this is just something that we don't want to set a precedent for in the future as it relates to, young folks on medication that seem to be working and just start from ground zero all over again. So thank both of you for your hard work on this.
Okay. Further questions? Representative Randall.
No question, Madam Chair, but at the proper time, I'd like to be recognized for a motion.
Oh, okay. Looks like, do I have anybody in the audience that would like to speak to this resolution that didn't have a chance to sign up? All right, seeing none. Representative Randall, you are recognized for a motion.
Thank you, Madam Chair. I move due pass on Senate Bill 385.
All right, we have a due pass. Okay, we have a second. Is there any further discussion? No? Okay, everyone in favor of House Resolution 1254, say aye. Aye. Anyone opposed?
We knew what you meant.
What did I say?
She said 385. I was reading one.
Who said 385?
1254, sorry. Substitute motion.
Okay, I thought it was me, so Representative Randall, so, okay.
Substitute motion, Madam Chair.
Anyone okay, do I need to do it again?
Yes.
Okay, anyone opposed, say no. Did we get the ayes?
Yeah,
The ayes have it. Good, the bill. Representative Randall, I was just going to say what a good committee member you are.
Used to be. Used to be.
We heard Representative Rogers today because the committee is losing several people, and I want to thank you for your service, for your willingness to work with other members of this committee and the time and your friendship. Representative Randall, you'll be missed. And I wish you the very best as you go forward in whatever career opportunities you pursue. So you're welcome. And of course, we're going to be saying goodbye also to Representative Kaiser, who is aspiring for another office as mayor of Atlanta. And oh, is this what you're going to be, mayor and what? That could be quite a combination for the city of Atlanta. They might not be able to ever survive it with the two of you together running it. You also will be missed. Thank you for the service on the committee, for your friendship, and being willing to all of us work together. I'm missing anybody else that snuck in and has not told me. Good. So I'm glad that as far as right now that everybody else is planning on coming back. And Senator Hill, you have perfect timing for today. So we will now have Senate Bill 389. Senator Hill, take your seat. We'll be working off LC 336623S. LC 336623S. Okay, Senator Hill.
Thank you, Madam Chair, members of the committee. Just want to start off by saying how grateful I am to the members of DHS that I've had a chance to work with. They've been great partners in this, and we haven't agreed on every provision, but it's been a great dialogue, and I have learned a lot in terms of how truly difficult some of the work is that we do at DFACS administering these programs. But so I wanted to start off with that. But Senate Bill 389, we've had some great dialogue and compromises throughout, but I believe this bill is 95% there, and I want to talk to you about a few slight changes that I would be okay with if the committee is okay, if the committee would like to proceed.
Well, this is a pretty it's a pretty involved bill, so I really think, not line by line, but you need to walk the committee through about everything it does.
Okay. Very good, Madam Chair. If you'll notice in lines 29 through 41, what we're doing is we're having the department give to the General Assembly reports annually, and we're basing, since a lot of these are federally funded programs, we're having the timeline be on the federal fiscal year, so that's why it says 120 days of the fiscal year. Noticing something, but and so that's important for us to get reports so that we can monitor the progress of these changes we're making. Lines 57 through 61, TANF is a 4-year program for a maximum lifetime benefit. We're reducing that to a 3-year lifetime maximum benefit. That's what the 36 months are. We provide hardship waivers, if you will, for this lifetime benefit to those who have experienced domestic violence. And so we're trying to help these, most times it's ladies, but obviously men as well, in domestic violence cases get back on their feet. And so they're able to have an exemption and get longer than the lifetime limit. Also, 20% of the monthly average can also receive a hardship, but I've talked with our department. We don't normally offer those outside of the domestic violence reason, but we are limiting it in code in that way. Line 69 through 71, this is we'll get to the cash diversion program, but if somebody, just because of their personal integrity or for whatever reason, gets money from the state and they want to pay it back, we want to push our department to figure that out and be able to receive money back from the cash diversion program if somebody gets back on their feet and wants to do that. So in other words, it's not going to be required that any of our beneficiaries do this, but they shouldn't turn them away and say, no, we can't take the money. Lines 124 through 126, this is about a work activity for TANF. Lines 130 through 143, this is the cash diversion program, and the department has one currently, and we've basically taken what they're doing and put it in code. The only difference is they don't currently have that repayment opportunity, and so we added that in there. But the bottom line is you can take a 12-month worth of your cash benefit if you agree to waive any future opportunity to be on TANF. And this is a great program to get people on their feet who don't want to sign up for welfare per se, but they want to take a once-in-a-lifetime cash benefit to fix their car, to whatever the case may be that they're experiencing. So again, the department was doing a program similar to this, and we've merely codified it. On page 6, this is the sanction that we're putting in for those not adhering to the work requirement within TANF. And again, the department is doing a wonderful job currently with this program, and so we're essentially codifying what they're doing, which is if somebody's not meeting the work requirement, they have a meeting. Our department then makes sure that they're very aware of the work requirement, and our group is saying they have to immediately comply. Well, I went ahead and codified they have 1 week to comply. If they don't comply within 1 week, then 25% of their benefit will be cut for 12 weeks until they get, back into compliance with the work requirement. If they don't get back into compliance within 12 weeks, they'll have 100% sanction, and then their case will be terminated, and so they won't be able to have the benefits anymore. And you can see the specifics on how much work is required, 30 hours. Lines 193 through 198. This is just the verification and eligibility data that they will provide to us. I think this is our reporting requirement for TANF that the General Assembly will get. Article 10, which is starting on page 7, this is all related to SNAP fraud, and this is a federally run program. For those of you who don't know, it's 100% financed by the feds in terms of the benefit, but the implementation or the administrative support is a 50-50 split with the state and the federal government. And so in terms of changing a lot of the way that this is done, we're not able to do. It's a federal program, but I did go ahead and codify the way this program works, and that a 100% sanction can be made. In other words, if you're consistently in violation of these principles, you can lose your food stamps, your EBT cards. And those requirements are laid out on the next page, where you cannot use the money. Which again, just so everybody knows, these are a card that you can't use at an ATM. The USDA gives a point of sale device to the retail store, so it's very difficult to conduct fraud specifically the way we've laid it out. But I wanted to go ahead and codify it just so that it's very clear. Then starting on line 260 through 272, this is the process of somebody asking for one too many times. If you come and ask for the card, we wanted to do 3, but the federal government required us to come up to 4. So if you ask for 4 EBT cards within a year period, then our signals should go up that there could be some fraud here. Granted, they may be losing the card, but they also may be selling the card. And so you can see that they will have an interview with a fraud investigator. And then on the 5th replacement, again, that's a lot, but that's what the feds require. Then they will have an interview with the investigator, and the process will be determined at that time as to whether they are conducting fraud, and they will be removed from the program. Talking with some friends of mine, we used to have $1,000 in the lottery piece. We raised it to $2,000. Friends of mine on the committee, we decided to go ahead and raise that to $2,000 instead of $1,000. So that's a change we made since the last committee meeting. Then in part 2, there was a House bill that y'all passed through this committee, and we put that in here, and that's basically taking a lot of these SNAP fraud initiatives and putting them in our criminal code, which is Title 16. So that's what part 2 of this bill does. Again, this committee has already voted it out. And then Section 3 is just a reminder to everyone, well, and of course the department, that this becomes law, obviously, this year in July 1 if it's passed, but it's not effective in terms of the requirements being put on the department for a whole year. And we did that because they're going through some important changes right now, and we want to give them a whole year to ramp up and get ready for these changes. I think I skipped over one thing, and I want to go back to it. There is a waiver on some of these SNAP initiatives that we can get from the federal government. And some of the waivers allow us to administer the program more effectively from a good business practicality standpoint. And we've worked with the department. We were going to get rid of some of these waivers and not allow our department to utilize them. But in conversations we found in many cases those waivers are helping us implement the program. But I want to put your attention to 235 through 237. This was a waiver out of our able-bodied program. And again, the members of the department can speak more clearly to it because they live it every day. But the bottom line is, if we're not going to give food stamps to able-bodied Georgians, then we have to comply with a program that helps move these people that are going to be adhering to a work requirement. We have to work with them. I guess we have to work with them just like we probably do in TANF in terms of helping them, resume, job placement, and professional development, those kinds of things. But as you can imagine, that's very expensive because we have to have the amount of people within our department that are going to be there to help those people along. And so I worked with the department because I wanted to get us out of this. In other words, I wanted to get us to the point where we're not really giving a lot of food stamps to able-bodied Georgians because we want them to be incentivized to go out and work. But the department, and I'll let them come and talk about it, they want to keep this waiver in place because it's going to cost Georgia a lot of money to ramp this program up. I wanted to leave it in really to talk to y'all about it so you understand this aspect of what's going on in our state. We all want to help people. We all want to move people from where they are to where hopefully they can be self-sufficient and working for themselves. But when you have, call them coaches or people that are trying to help people move out of the situation in which they are in, it's going to require a larger investment from our state per person than just giving them food stamps. So food stamps is, what's the number, $128 a month or something, or 200 something? I can't remember the exact number. But if we were to actually help people and look them in the eye and move them up from where they are, then you're paying a salaried person. So there's an order of magnitude that we should know as a state, but I'm willing to get rid of this provision because the department is interested in us still allowing them to have the flexibility as we grow this program throughout the state. So with that, Madam Chair, I think I'll leave it and answer questions, and I know the department might want to speak to the bill as well.
Okay, I think I'll do this a little bit differently. I think we've heard your presentation. I think I'm going to ask Director Cagle to come and, give us the department's perspective on that, and then we'll ask y'all questions. Is there another chair? Yeah. Oh, are we short a chair? Sorry.
Thank you, Senator. Thank you, Madam Chair. We have worked diligently with Chairman Hill to come to a mutually agreeable bill. And we, first of all, want to say that the spirit with which this was put forward is the spirit in which we're working, which is to run the economic services programs in the state in a efficient way, and to assure that to the greatest extent possible, those that are receiving the benefits that are able to work are working. And so the intent is the same on both sides of these issues. You also need to consider where we were. At one point when I came aboard, we were under the threat of a $76 million penalty. John came on about 6 months after I did to help me run this. We are now in a much better place than we were at that point in time, but we are still under the threat of a fiscal sanction of about $15 million. What we have to do to avoid that is to keep the timeliness, meaning make the determinations of each eligibility case up to a standard of promptness of 95% of the cases. That has to be done by June 30th of 2016 to avoid these fiscal sanctions. So we are also under a warning letter for improving the quality, making sure that the eligibility determinations are accurate. We have a 5% margin of error there as well. And so those things make it really important that we're careful about making changes to the program at this point so as not to impede our ability to meet those. There's an additional caveat here. It's a Melanie K. federal lawsuit that's a class action lawsuit regarding the timeliness of these cases. And it requires that we meet a 96% timeliness rate for 6 of 7 consecutive quarters, basically 2 years. This has been one of the harder things that I've done in my career. This is a system that we had to change entirely when I came aboard in order to be able to make these things happen.
Director Cagle, do you mind if I interrupt?
Absolutely.
Okay, because we don't usually have this kind of bill. So are we talking about the fact that people who were applying, that the system was way too slow in taking? How long was it taking, and what time period must you meet now for the committee?
So the time period is 30 days in a typical case, 10 days in an expedited food stamp case, and that's where you have people with very low level of resources basically don't have any money to buy food. And so we have to meet that standard of promptness in both of those situations at a 95% level.
Okay, what were we doing?
We were at 66% prior to my coming aboard, okay. And had about 52,000 overdue determinations. To give you an idea of what that means, we usually reject about 25% of the applications because they do not qualify. So 75% of that 52,000 were people that qualified for the benefit, but we were not able to timely determine their eligibility. If you keep in mind also that this program primarily serves the elderly, blind, disabled, and children, we had a situation where you had the people that need this assistance the worst that were not getting it in large numbers.
Is this the calls we were getting when people said nobody was answering the phone and they couldn't get through and they were calling and calling? So this, I know that was before you, Director.
Actually, Madam Chair, it continued into the beginning of my tenure. And I've told the Senator this as well. When I first came over, the governor actually asked me to go over to take care of issues in the child welfare program. For the first 6 months that I was at the department, I spent more time in these eligibility programs than I did there because you have 1.6 odd million people that receive these benefits. We had a phone system that was handling only about 33% of the calls that were made. We had people holding up to 6 hours on the telephone, so we had to completely change the service delivery system to move away from a call center-based system back to service delivery in the county offices. And that's what John and I have been working to do since he came aboard.
So one of the things that you've asked the senator to do, and I understand that he's worked with you, is to not make big program implementations until we can take care of the problems that we had, not add extra work for you so that we can meet the timetable put on by the feds in the lawsuit.
That is correct, Madam Chair. And in particular, the primary consideration that I wanted to speak to is in lines 235 through 237, and that is the prohibition of seeking, applying, accepting, or renewing any waiver, and that's in our food stamp program where we've got the biggest problems. We appreciate the senator's willingness to remove that from the bill, and we would encourage the committee to favorably consider that. At present, we have 7 existing waivers. All of these waivers are administrative in nature and really help streamline the administrative process so that we can move quickly in getting these determinations made. And it's really a key to our being able to meet this 95% timeliness and then the 96% required by the federal lawsuit to be able to conclude that. And I think John Anderson to my left, he is our Deputy Director for Economic Services, and he's going to speak to the TANF piece of legislation with your permission.
Okay.
Good afternoon, Madam Chair and members of the committee. What I wanted to speak to was on page 3, lines 81 through 84, which encourages the formation of two-parent families, and when a TANF recipient marries, the new spouse's income and assets were disregarded for 6 consecutive months.
Move that a little closer so we can hear you?
Is this better?
That's better.
Okay. Do you need me to start over, or are you okay?
No, you're looking at lines
Yeah,
81
the only
through
thing
84.
Excuse me?
Lines 81 through 84.
That's correct.
Okay.
Yeah, I just wanted to point out that when current TANF recipients get married, we don't include them in our federal grant, that we pay for them out of all state dollars, so that we don't have to meet the 90% work participation rate that's required by the feds for two-parent families. So if we're putting this type of activity in, which is favorable to the agency, there could be a state fiscal impact to it because you're keeping families on a little bit longer than we normally would have.
Okay, so are you asking for that to be removed, or?
I think he's just letting us know, and I am asking to speak because I think I just oversight didn't speak to that. That is a marriage disincentive that's in our policy, and I was seeking to remedy that by for 6 months not taking into account the dual income nature of the family, which would expel them from the rolls, and giving them a 6-month, keep them on the rolls for 6 months. And so I can see how there would be a little bit more investment from the state there, but I thought we should try to incentivize marriage because there's been such a finding that marriage is good for families in poverty.
Well, I mean, that's certainly true, but is this I knew that there were 2 issues that the department wanted removed. Is this the second?
I don't think they were asking for it to be removed.
We were not. That was a point of information, Madam Chair. The other issue that we wanted removed was actually removed in this version of the bill, and we appreciate the senator's consideration on that.
Well, since we have to be careful with our money, do you have an estimate on what leaving in lines 81 to 84? And I certainly understand why the senator would want that, and we should encourage two-parent families, because that it certainly research shows is better for children and the long haul and all. Do we have an estimate of what that is going to cost? And is the governor, can your budget handle that since the budget's already been done, or?
There's a year before this is implemented.
Right.
So in terms of this doesn't have to be in fiscal 2017 budget.
Okay. And you feel like that's a reasonable time length, and you can?
It is, and what we intend to do is do a really in-depth fiscal study of this so that we can come back to the legislature and report next year in the event that it's going to be out of proportion to what we typically would spend.
Okay. That question. Okay. Go ahead. I'm sorry to have interrupted.
That was all for me.
And Director, that's other than that, you're okay with the rest of the bill?
Yes, we are.
Okay, thank you. Okay, let's go with questions from the committee. Representative Broadwick. Oh, gentlemen, why don't y'all all stay? Because depending on who they're going to ask. You too, Senator, of course. Come, pull your chair up.
Mr. Thanks for being here today, but my question is, in the interim, if this is going to be actually a year, do you feel that the department has got resources and training materials available to get the caseworkers up to speed with the anticipated program changes? Do you feel like you're ready for that?
That will be a challenge. It's one of the things that we've discussed with Senator Hill. We are also at the same time trying to, of course, stay out of this penalty phase with the feds. We also are bringing up a very complex integrated eligibility system, which will be used in all of these cases. So there's a lot of training that's required for that. So if you look at that, we're going to have people offline for about 6 months out of the next year doing training on the integrated eligibility system. So we will fit the training in around these other things, but there are challenges involved there.
All right. Certainly that the recipient will understand the ground rules so that they don't get in trouble as far as penalties and so forth, and understand the rules for their eligibility and what their reporting requirements are.
Yes, sir. This will give us an opportunity to do both the training as well as the policy changes that are required,
Okay.
and we think we can do that.
Thank you very much.
Okay. Representative Beverly.
Thank you, Madam Chair. A couple quick questions. Number one, how many people are actually on TANF right now?
2,300.
2,300. What's the average amount of money that they get a month?
$235 for one child household.
So the average for the 2,300 folk, $235 a month, which, is that a family?
That's for a family.
Okay.
Yes, sir.
So for over the course of a year, you're talking about $3,000. Is that correct? Is that more or less?
Yes.
And then you're talking about in a lifetime, $9,000.
Around there.
Right. So the state of Georgia is effectively saying, what you're effectively offering is that if you're down on your luck for whatever time, state of Georgia is going to give you about $9,000, so you can get a one-time payout of $3,000. Right? Is that what we're doing? Is that what this bill effectively does in the TANF space?
Well, can I?
Yes, absolutely.
There's a cash benefit, there's also a housing subsidy, and then there's a transportation subsidy and child care. And so they're talking about the cash benefit. And
Right.
so when you get on TANF, you get the benefits of those other additional services, subsidies. But I mean, I'm not trying to argue with the point you're making. It's just that there is a little bit more of a benefit when you join TANF than if you were to just take the cash diversion program.
And right, I think you just set me up for the next part of the question, which is, and what is the average amount for those other additional benefits? Right.
We don't have that handy.
So okay, so it's probably less than $20,000. I mean, for a lifetime for someone. All right.
We can certainly get you there.
Yeah, that'd be great. But I think we are in the state of Georgia are far better than offering somebody $9,000 over the course of their lifetime if they're down on their luck. And it's in the way that the law is written is this is it. You got 36 months, and that's it. So my question is that what we want to do as a state? And we have a right to do that. You have a right to bring this law. But I think there's a human toll that we need to consider. And that human toll that we need to consider is the fact that I'm almost 50 years old. And I can guarantee you that at least 5 of these years, these last 50, just about, they haven't been good, very lean. And I've never been on TANF because I'm in the legislature. But, right, that's why I was late.
You don't qualify, but otherwise
I
you
know,
would.
Right, that's a month. But but I represent about 68% of my district probably qualifies for this. And I have come across patients of mine and people who I've served who their benefits not 235, it's like 128, 127, $200. How do you expect somebody to live on that? And when there's no opportunity in these communities, I understand what you're trying to do, but there's not really opportunities for gainful employment. Even if you made minimum wage, you're talking about $7.25 an hour, right? $700 a month. How do you afford anything in that space? And you got to make 25% of that. I mean, this bill is whittling away at I think the life chances of people really getting on their feet. That's just my opinion. But I do think there's a better way to do it, and I would really be interested in what the absolute benefit is over the course of 3 years. And are we going to take the people off of transportation and in housing as well in 3 years? I mean, we just said TANF, but is the transportation component and the housing component, are they going to be gone as well in that 3-year period? So, thanks.
A couple of points, Representative, and I appreciate what you're saying and suggesting. But I would say that if there was no end, if you could be on TANF for the rest of your life, I would argue to you that what we're giving them isn't enough. And so my point is that when you make it in purely economic terms, this is not very much money. What I'm hoping to do is to incentivize people specifically to come off of these, because we want to help them to where they can get those higher incomes and do it all on their own. You raised a good point about some of the depression in some of these counties where there's not a ton of opportunity, and I would be willing to work with a department who has that data if there's other things that we can do. But the goal, the key point is when you minimize the or I guess should say diminish or summarize the program in purely economic terms, this is not an aspirational goal, and we wouldn't want to keep any family on this for a long period of time. My goal is to get people that come onto a program like this to immediately begin moving them from this subsistence program, to self-sufficiency. To your point, if they were going to get an additional year, what changes in their life are we hoping to accomplish in the year between 3 and 4 that we can't accomplish in 1 and 3? In other words, if somebody's going to need it beyond 36, they might need it beyond 48, and they might need it beyond 60. If you're going to diminish this entirely to economic terms, I mean, the goal is and should be, and I know it is with these gentlemen and this team, is life change. It's not to subsist people financially. And so I was amazed when I got into this and learned how little money we're giving. I'm not suggesting people are getting rich on this program. Now, on the SNAP, there's some fraud we wanted to address. There's no fraud within TANF that I am aware of. I mean, and we're trying to help people aspirationally, and it's not a purely economic benefit that we're trying to provide.
And thanks for that answer. The next part of that is, because it's going to be new, if someone's on TANF right now, they've been on it for 3 years, once this law goes into effect, are they immediately dropped, or does it start from the time that this law begins?
I think it's fair that particular issue, we had some conversations about that, and they might need to figure that out and get back to us in terms of how they would implement the change, unless you already know.
In looking at this to be ultimately fair to the people who are currently on the program, I think what we would do is grandfather them in under the old rules and then apply this going forward from the date of application, so that we didn't adversely affect anybody. Madam Chair, if I could also, I need to correct something. I think John and I gave 2 different answers to the same question. I think we both heard it slightly differently. The amount of money per grant is $159.69 if you have one parent and 1 child. The average amount is what John stated, which is the $260 range.
Okay, here we go. Okay, we have more questions, but you sort of lost me on this. Are we just debating on that last discussion going from 48 to 36 months, right? Correct? That was it. Okay.
Yeah,
what it would do, the difference of a year. Okay. And do I understand from lines 57 through 61 that there is a lifetime maximum but that the department is able to grant an exemption, a waiver for an exemption to that 48 or now, or if we move to 30, 36, if the department deems that it's a situation that the person, for whatever reason, needs to continue?
I was amazed in my conversations with the department that I put in 20%, but they said that there's no one that falls into this category other than domestic violence, which I was amazed by. But that's why I crafted the language like this. So we're giving them an opportunity, if they deem it necessary, to help folks, like Representative Beverly was focusing on. But it is limited.
But it now expands to people beyond domestic violence victims.
That's correct, and the law federally always did, and we just codified that.
Okay, so that's not taken away in cases of extreme emergencies and problems. There is, for whatever benefit it is, there is some type of safety net at the department's discretion. Okay, all right. Representative Kaiser.
Thank you, Madam Chairwoman. I guess this would be to the author, Senator Hill. Hey, actually, it may be Commissioner. Can you describe when you're talking in section lines 173, where you're talking about the work activity requirement? Is that actual? I mean, I guess my question is, what is work activity requirement? They have to be working, or they have to demonstrate that they are looking for work?
Work activity could include work itself. They found a job. It could be a volunteer type service to a nonprofit that is approved by the department. It can also include education that will lead to eventual employment.
So if the person chooses that work is how they want to fulfill the requirement, if they demonstrate due diligence, that they are actively seeking work but are unable to find work, what happens then?
As long as they can continue demonstrating active
searching for employment,
search for work, or one of the other education or volunteer service, they can continue to receive the benefit. Now, there is a maximum lifetime benefit set in federal law, and that was previously addressed in the 48 and 36 months.
Can I follow up, Madam Chairwoman?
Yes.
I just have one last question, if I can. When you, on lines 261 to 263, I'm just not, real familiar with the program. So when you have the federal government requires 4 opportunities to ask for a replacement card, how often does that happen among the recipients? How often is a replacement card requested multiple times?
That happens in about 10% of our active caseload, which is a little over 1.6 million cases currently.
A year?
Yes.
Okay, thank you.
And Representative Kaiser, you were asking how many went past 4 in that question? How many?
Well, just how many times did someone, well, I guess, reach the limit of 4 would be a more specific, better question.
So there could be multiple reasons, and again, that the number that reached the maximum is about 10%. So
it is 10% that reached the actual 4th request.
Yes.
Can you give us an idea of what some of the reasons they state for requesting replacement cards are? I'm just curious.
Madam Chair, Maurice Ingram is our fraud investigator, and he's
Right.
the one that does the fulfillment of the cards. Could he
Okay.
speak?
Yes, ma'am. Yes, sir.
How are you doing?
Just go right there to the...
Thank you. So there are multiple reasons that you would have a card replacement. So let's look at the elderly population as an example. Some people wouldn't understand that having that card is a lifetime thing. So if you have it, you go off of food stamps, you come back on. As long as you hold onto that card, we will deliver your benefits to that same card. So some people may throw that card away. Some people may damage their card. Some people may go to the grocery store and put the card on the little scanning machine that desensitizes the card. So there are a lot of different reasons. So that's why that threshold appears to be so large. But when we're talking about the lifetime of the program and reaching that 10% threshold, when you really look at it, it's not a tremendous amount of people who are replacing their cards annually.
Yeah, I think that's what I was getting at. But can I ask one more specific question, Madam Chairwoman?
Yes.
How many of those, within that 10%, how many of those are elderly people?
I wouldn't have that exact total, but when we look at the number of people that we've had to contact within the last year, you're going to look at about 30% of those individuals to be elderly, and we're really educating them on the program and talking to them about maintaining their cards. Another example would be if someone is a payee for someone else, and so that person would move to someone else's care, or, and that could be those who would be disabled, then that person, of course, would get a new card, and we would deactivate that last card.
Okay, thank you.
You're welcome.
Thank you very much for that information. Representative Fry.
Thank you, Madam Chair. Senator Hill, I wanted to tell you thanks so much for your work on this. I heard that you've been very flexible and very easy to work with during this process, so thank you for that. Commissioner Cagle, you've done a smack-up job since you've been down there, so good job on that. I've got a couple of questions I want to ask you specifically. There seems to be some places in this bill that we don't know how much it's going to cost the state in the future. Lines 60, if we go back from the 48 to the 36, how does that affect you guys? Well, first off, let me preface that. Has there a fiscal note been done on this piece of legislation whatsoever at all?
No.
There hadn't been. So
I hesitate because is my assistant here? I asked for one, and I don't know if I have it yet. I asked for about a week ago, so it's in process. But specifically on the provisions of this new substitute, we do not have a full fiscal note.
okay. And so in line 60, if we've already got our program set up at 48 months, and I understand what we're trying to do, if we can save some money, we can help more families out. But is there a cost associated with dropping it from 48 to 36 months within our state budget?
Yes, there is. The estimate that we got, and this is just from talking with our IT folks, so it's not a solid estimate, but we think that there's a system change that's required in the new integrated eligibility system, and this will run about $40,000 in order to be able to complete that change.
Thank you. Can I ask a couple more questions?
Yes,
So line this 81 through 85, I just want to clarify that we're not going to take that out of the bill. We know it's going to cost us some money. We don't know how much it's going to cost, but we're going to deal with that next year. Is that what I heard?
That is correct.
Okay. And then line...
Can I also add one thing? My friend who told me this, maybe it's actually, I don't know, but that we can't necessarily even do this. But I wanted to keep it in from a principle standpoint, and what I mean by that is the federal government has said we're not allowed to waive someone's income in order to give them benefit.
Right,
Does that make
right,
sense?
right. Yes.
But I want it in there. I want us to try to look into it, but we might not be able to immediately enact this particular piece. Is that accurate?
That is correct, Senator, and the process required behind each one of these changes is that we'll need to take it to our federal partners and get their approval for changes in our state plan in order to affect these.
okay. And basically be asking for waivers, and if they're denied, we know we can't do it.
Yes, that's correct.
Follow
Okay.
up. Just one more?
You haven't
May I?
asked many in other committee meetings. I'll give you one more.
Yes, ma'am. Thank you. And just a point of clarification on that. So, I'm okay with it being in the bill, but is there any, this is a legal question. I'm not a lawyer, but you are. No, you're not. Lawyer in the room, Representative Kelly. If we make a law and the feds say you can't do it, then how does that work? Do we just scratch it back out off the books? We have to change it later? I mean, I'm being dead serious. I'm just trying to figure it out.
Betsy can answer that.
Okay, wait, can we let Betsy answer that, please?
Yeah, I mean.
I saw the look on your face, Representative Kelly.
If it
Not
was
your area of expertise? Okay. All right, but let me let Betsy, if you don't mind. Okay.
Okay, if it passed like this and it was determined to be in violation of federal law, it basically would be on the books, but it wouldn't be enforceable. So it would be sort of moot language, and at some point, hopefully, we would clean it up, but it would kind of be no harm, no foul, because the federal law would, of course, trump it.
So,
Thank you, Betsy.
Representative Kelly, you want to add anything?
I agree.
Okay, good. Then it has your seal of approval. Okay, Representative Randall.
Thank you, Madam Chair. I'm sitting here and we heard this bill last week, and it's still just as problematic as it was last week. And I'm retiring, so I'm gonna say whatever I want to say. A lot of y'all know where I come from, and I don't know a whole lot. I never really received anything free, and but one of the best things that ever happened to me in life is that I worked for Defects when I finished college. And it introduced me to a world that I had never been exposed to, just had plain old misconceived thoughts and notions about what goes on with people that find themselves in a place where they have to receive TANF benefits or child care. I worked on the old Work First. Y'all remember that, when we had money to help folks overcome any barrier. And even with that kind of money that we had to invest, there are still some folks that need a little bit longer, a little more of a help and a hand than others. And this bill, we heard it for over an hour the other day, and I think I fell asleep and woke up and we were still hearing it. And it's just as many questions today as it was yesterday and when we heard it. And I think it's some unintended consequences. Back when I first got elected, we used to call them Hanks and Boogers. And it's still just as many of them in there. And I'm not sure if it has no fiscal note. So many questions that can't be answered. But what I do know is there are some unintended consequences. And I'm going to say unintended because I don't believe Senator Hill would do anything to hurt anybody intentionally. And because he's a fine gentleman. And so, Madam Chair, I don't know how many other people, you probably got 12 more people that want to ask questions. I don't really have a question. I try to think of something profound to say about this bill, but I just don't like it, Madam Chair. It's just, I think it's just bad, it's going to be bad policy. Betsy already told us it may be trumped by the federal government. I mean, I'm not sure how much further we ought to take this show. And, I don't know if you're going to recognize me. You probably say no, but I'm on my way out. You won't hurt my feelings. But I probably would move to table this bill. And I bet I could get 4 or 5 folks that'll second, third, fourth, and probably would vote for it if they had a chance to table this bill so that Senator Hill can try to look at it over the summer and over the interim and go to prayer meeting on it and see if he can perhaps, make it something that would really be beneficial to those folks that are going to be affected by it, because he's probably like me. He probably never had an opportunity to receive any benefits. We might have got a few food stamps in college, but if you've never had an opportunity, I mean, I wouldn't say opportunity, if you never had been in a position where you needed some help, you don't know what you deal with. You don't know if 36 or 48 months will be enough. And heaven forbid if it ever happened to any one of your loved ones or any one of your constituents that really find themselves in a bad place. I had people on my caseload, and Lord knows I had way too many, so I can't remember. They kind of run into each other because you have so many on your caseload when you're a caseworker. But I had so many folks that had been living in the finer parts of Macon and found themselves on hard times. And the last thing they wanted to do was to come down there and ask for help. But then they finally had to, who's to say how long it's going to take them to get back up? Because who's to say how long it took for them to get down and what the circumstances were? So, Madam Chair, I think I'm rambling, but that's some things I always want to say, and I've been here 17 years and I didn't say it, so I'm just saying it now. So,
that's fine. And I'm not going to recognize you to table the bill, but I'm glad you had your say.
Not now, but maybe later?
Yeah, I don't think so.
All right.
Because sometimes you just want to deal with the bill and get it over with. Representative Bennett.
Thank you, Madam Chair. To my esteemed colleagues, and I believe one of my
could be classmates, Senator Hill. Thank you. Question last week and back again this week. Why are we really here? I appreciate the incentives that are thought-provoking for this bill, and I'll be brief, Madam Chair. My question is also around the time frame. Has there been any evidence to say that 46 months over 48 months would actually yield the outcome that you intended? And if so, what does the evidence say? How does it speak to the difference in 46 and 36 months? Or did you just pull that number out of the sky? And then secondly, is it possible, since they say you've been very good in working with people, if there can be a graduated plan? 1 year could be a dramatic difference in someone's lives who's trying to get themselves back on their feet. So those would be my comments and my concerns, Madam Chair. Thank you.
Thank you. Okay, Representative Henson, you get one question, so just put the question.
I would like to know why we need this bill and what are we saving in state funds and why is it necessary, because I agree with everything that Representative Randall is saying. And Madam Chair, I would also vote to table this bill and let Senator Hill work on it over the interim.
We're not, the department and the senator have worked closely together on this one, and I think we've come to probably the changes that we're going to make. So you're not recognized for that, wouldn't be recognized for that. So, okay.
Can I answer the question, Madam Chair? Or not? Or do you not want me to?
Briefly.
Well, first of all, I appreciate what Representative Randall said, and you as well, Representative Henson. Keep in mind, we've not, and we never intended to, tighten eligibility requirements or lowered the monthly cash amount. I mean, speaking with Representative Beverly, I wouldn't even be opposed if we looked at raising the incremental monthly amount that they get. That's not the issue here. It's not about money. This is about helping people move from this difficult position that they're in out of it. And so, most of what we've done here, except for a few issues, is codifying what this great department is already doing. And so you ask, why do we need it? The answer is, things change. They may leave. This governor's going to leave, and I want to put in best practices into law so that there can be legislative accountability. And if there's changes that need to be made over time, I hope that the wisdom of the legislature intervenes again to improve on some of the changes I've made.
Madam Chair, he did say one thing there that I'd just like to ask, because he's saying that he wants to help them to move from this position that they're in. How does cutting off a year of TANF benefits help them? What are we putting in place to train them to do to train them?
Representative Henson, you
and
were
everything
late,
else.
and I think we went over that. And in the sake of time, I'm going to cut you off on that one. Representative Kelly.
Make a motion.
Thank you, Madam Chair. I want to thank Senator Hill for the hard work he's done on this. And since everyone else was making motions, I was just going to motion to pass, Madam Chair.
I'm not recognizing you at this time. We have people that want to speak the bill. And so I'm going to start, and if you will, for the sake of time, I'm going to allow everybody to go for about a minute, no longer than about a minute and a half. Mr. Drummond, tell us who you're with. Time it, if you will. Do we have a timer? We do.
Madam Chair, members of the committee, my name is Wayne Drummond. I'm the Executive Director of the Georgia Professional Human Services Association. When welfare reform came along in DeKalb County, we had 7,700 TANF recipients subject to work requirements with a 48-month lifetime cap. At the end of that 48 months, we had 5 of those 7,700 families to lose their eligibility. I know what works in terms of welfare reform. I'm here to speak against reducing the cap because we need time to work with families that have multiple barriers. Citing a study from Wisconsin done post-welfare reform, 17% of TANF recipients have a disability. 5.2% have a child with a disability. 23% report poor health. 52% have no diploma or a GED. 7.4% reflect an unsafe or abusive relationship. And 37% report mental health problems, and a lot of that is depression. If you're that chronically poor, it's depressing. The point being is that it takes, when 56% have 2 or more barriers and 28% 3 or more barriers to employment, we need more time to work with them, to help them do as the senator styled it, to have a trampoline to rebound to success. That's what the department has done in welfare reform and done a great job with. The time to help families is necessary, and we'd appreciate your consideration. Thank you.
Thank you, and thank you for keeping to a time schedule. Melissa Johnson. Hit the time thing. I'll be right back.
Good afternoon. I'm Melissa Johnson. I'm a policy analyst with the Georgia Budget and Policy Institute. I wanted to highlight 2 concerns quickly, one with lifting the lifetime limit for TANF and one with the SNAP sanctions in the bill. As you all have heard, we're talking about 2,364 adults statewide who are receiving TANF cash assistance for themselves and their families. And very modest cash assistance at that. So the families who are using this cash assistance, most of them, 80% of them, are using it for less than 24 months. The families who are most likely to be hurt by decreasing that lifetime limit are the ones with the most barriers, as has been said. Multiple studies tell us that TANF recipients who run into these lifetime limits have problems with cognitive functioning, lack of education, so they need more time to address those barriers. And then lastly, in Section 1-7 of the bill, the SNAP sanctions, we want to make sure that you all are aware that 72% of Georgia's SNAP recipients are either children themselves or adults in families with children. So when we make it easier to sanction families, that's less food coming into those households. So we hope that you would consider those ramifications both in TANF and SNAP for the bill. Thank you.
Very much. Okay. Okay, Zach Kahn.
Good afternoon. My name is Zach Kahn. I'm the public policy advocate with Families First, and I know the chairwoman likes it when we're brief, so I promise to be very brief. I'd just like to echo what Melissa Johnson from GPPI said. We're particularly concerned with the increased sanctions provision of the bill. We'd like to echo Ms. Johnson's concern that we understand that the increased sanction is meant to be punitive against adult individuals who are in noncompliance or who violate the terms of their eligibility for public assistance benefits. But oftentimes the people who rely on these public assistance benefits are children, and of course children can't determine their circumstance or their luck as far as what family they're placed in and the means that are provided to them. So we just want to draw your attention to that and also echo Representative Randall's statement that this is, of course, an unintended consequence, and we believe and know, along with Representative Randall, that Senator Hill has the best intentions for Georgia. So we just wanted to draw your attention to this part. Thank you.
Thank you. Elizabeth Apley.
Madam Chair, members of the committee, on behalf of Presbyterians for Better Georgia and All About Developmental Disabilities, I just wanted to raise some concerns with the bill. I've spoken with the author and appreciate his flexibility in addressing some of the concerns that we've been expressing. We do have 5 remaining concerns because the noble intention of helping people to move out of poverty is unfortunately not adequately addressed in the 4 corners of the bill as it now stands, and instead we are cutting off this very important safety net to the most vulnerable in our community by reducing the lifetime limit from 48 to 36 months, and I know you all know that the federal law allows a lifetime limit of 60 months. We would be reducing almost in half what's available under federal law. And according to the Georgia Budget and Policy Institute, 80% of people receive TANF for less than 2 years. So this is a small percentage of people who need that life rope, but for those that need it, they are extremely vulnerable and their need is intense. The cash diversion program, as it's been recrafted, proposes to give people help with a cash optional loan that would require them to permanently forego their ability to receive cash assistance. And that's too high a price to pay. But we know when people are desperate and they need that cash in order to serve their family, that they might make that Hobson's choice or be forced to. And so we urge you to consider striking that language. We ask you to allow the state to retain the flexibility to pursue waiver when that's appropriate, and we ask you also to consider not increasing the sanctions from 25 to 100% because you're talking about taking food away from children when you take away TANF from an entire household.
Thank you very much. Okay, to the committee. The posture of the committee, I think, Representative Kelly, I'll recognize you now.
Madam Chair, I'm sorry, I didn't mean to interrupt, but there was one issue that I had conceded.
No, I'm going to ask you in just a minute
Okay.
to make the amendments. Okay. Okay, do I have a second? Okay, I have a motion to pass the bill in second. I know there are amendments that want to be made. At this time, I will take amendments. Senator Hill.
On, thank you. On line 235 through 237, we can strike through that.
Okay, we have a motion to strike lines 235 and 237 and renumber accordingly. Do I hear a motion?
Second.
Okay, I have a motion and second. Any discussion? Okay, everybody in the favor of the amendment, say aye.
Aye.
Anyone opposed, no. Okay, the ayes have it. Okay, did you have
I'm not.
the other one that was included, Representative Cagle?
Yes.
And that was it. Representative Fry.
Thank you, Madam Chair. I just would like the opportunity to just clean up the last bit of fiscal question that we have in this bill. Since there's no fiscal note presented to the committee, line 60, we strike 36 and replace it with 48. And then this would turn into a revenue neutral bill for us.
Okay, we have a motion to, on line 60, to strike 36 and replace that with the number of 48. Do I hear a second? Okay, I have a motion and second.
Appreciate my Democrat friends putting fiscal responsibility first.
You know it.
Yes, we're ready for discussion.
The author of the bill, I mean, this is actually a huge component of your bill, so what your thoughts are on that amendment?
You know, I appreciate that, Chairman. There's a lot of talk on this issue. We have hardships available. Their hardships are available, waivers for people that are disabled. The department works with people that are long-term disabled to get them other assistance programs that our government has. It's been said by the proponents of leaving it at 48 that most people, 80% of them, come off of welfare within 2 years. There are some costs associated with this as a result of the department having to make a change order in the current process because they're developing a software platform. You know, I just think from a standpoint of what we're trying to accomplish, which is to help move people off of the program, the shorter amount of time that they're on it is the benefit. That is the benefit. Those that truly need it there are opportunities for them to stay. There's no long-term need. There's no long-term timeline for food stamps, for example. You can. So I'm just saying, it's the pleasure of the committee, but I will tell you that I think this is not a radical move either. Some states have 21 months, but my whole point in this is if you have a problem that you could not get fixed in 3 years, then you're going to have a problem that's not going to get fixed at the 49th month. So you're going to hit that 49th month and have the same challenges and problems that people are facing. Now, if people could prove to me that the 4th year is this launching pad year of huge change, then I would change my tune. But that's why I've offered the 36.
Director Cagle, I hate to put you in this position, but I think we have to ask for honesty as we make this kind of a decision, sir. How do you feel about this and the value of shortening the time versus leaving it where it is? I mean, this is a big decision for this committee to make.
Absolutely, and I think there are benefits to this, which I would sum in saying that if we do a good job of letting people know about the time limits, it puts more expectation in a shorter time frame. However, I would have to also agree with one of the speakers that those people who will need that extra 12 months beyond 36 months are people who have very serious conditions, and in particular, substance abuse and mental health are two that come to mind.
And there are waivers for them already to extend past the lifetime.
Is that correct, John?
Up to 60 months.
Up to 60 months for them.
There are waivers that they.
Excuse me?
What were the two conditions, Madam Chair,
Waivers for, I think the director said that especially people.
Substance abuse and mental health.
And mental health. There are waivers for.
And domestic violence.
Okay. Do you feel, Director Cagle, that the number of people's on this, to be perfectly clear with those waivers, we are now saying it cannot exceed 20% of the average monthly number of families which were on TANF provided during the current fiscal year or immediately the preceding year? Would that in any way, would those people with substance abuse or mental illness, would that number very likely exceed you and put you over that 20%?
I don't think it would. We're good with the 20%. I think our questions are revolved around 36-48, but we are good with the 36.
Okay. All right. Representative Kelly.
I'll waive.
Okay, waves. Representative Stevens.
Thank you, Madam Chairman. I sit here and listen to this bill, Senator Hill, and I think about a little lady who had 5 kids and was on government cheese. And none of you all have been on government cheese. None of you all have been down on your luck. I know, because I'm coming from a family of it. And it's sad to say that we're sitting here arguing about whether we're going to keep somebody on it 48 months or 36 months. It's sad. It's sad. It's a sad statement for us as a legislature. And we're playing political games on an election year, and they're playing partisan politics that we normally do every day. It's sad. It's sad. I could think of my mother with her 5 kids. And in the end, if it wasn't for the government cheese and other government supplements we got, we wouldn't have. I have a brother with a PhD. My sister has a master's. I have a master's, and my twin brothers have BS degrees. All because we had somebody to stand with us when she was down. It's a sad state of affairs, sir. Thank you.
Thank you. All right, we're ready to call the questions. We've had discussion. There's no further questions. Everybody in favor of the amendment to strike on line 60, 36 months, and insert 48 months, please raise your hand. 12. Everybody opposed? Okay, the nays have it, the amendment fails. Okay, we are now in the position of the passage of the bill. Everyone in the favor of the passage of the substitute to SB 389, as we have amended, it'll go out as a committee sub. Raise your hand. Okay, everyone opposed? Okay, the ayes have it. The bill passes. Thank you very much. Thank you to the director and thank you very much for coming. Okay, so that we can, what? Oh, okay. We'll have a minority report filed. Okay. Let's move on very quickly to Senate Bill 385, please. Thank you. You know you have to, Senator Hill, you know you have to go by rules. It's supposed to be. Okay, Senate Bill 385. Senator Hill, we're working off LC 287967. And please make it very quick.
I will. I should have had my cousin finish up for me.
Okay. Hey guys.
Thank
Some
you
of us have some
Thank you,
places
Chair.
to be.
Thank
Come
you,
on.
Representative. This bill is no stranger to you because Representative Betty Price had the identical legislation before you a few weeks ago, and it was House Bill, I was looking it up real fast. It was a House bill that I had it before me, but I'm in 3 committees at the same time. Anyway, she had this measure before you a few weeks ago, and it simply relates to board certification of physicians. Maybe Representative Price can tell us the bill number. I've got it in my text here.
826. It's not important. We're looking at your bills.
There's a concern in the physicians community that some physicians are holding themselves out to be board certified when they're not. This was taken up by the House of Delegates, from what I understand, last year in their meetings. And this measure simply says if you're board certified, you can state that you are, and if you're not, you can't. That's the bill.
Questions for the author? Okay, I've got a motion to pass in a second. No one has signed up to speak on it. Any further discussion? Okay, pardon? Okay, Representative Price.
Thank you, Madam Chairman.
Oh, we do have
Senator
some-
Hill, I believe that this bill is quite different from the bill I put forward. So I'm not in any way implying or wanting anyone to imply that because we passed my bill before, that this one would also follow in line, because I think it's very substantially different.
Is there a substitute before you? Or is it the bill itself? The bill itself is, from what I understand, was the same language, but I apologize, Representative. The bill itself.
What it says is that it's the bill. It doesn't say what.
Okay. The reason I ask is because there's been a lot of discussion over the last few days about amendments, which I did not support, and I don't have the bill before you. But simply the bill states what it says on one page there before you.
I mean, this says Senate Bill 385 does not say a substitute by Senator Hill of the 32nd.
I apologize. I may be incorrect. I think I got a hold of a potential substitute that is not obviously what we're looking at. This is identical, I think, to my bill. Is it not?
My intent was to be yes, and what's before you is what was introduced in the Senate. I just have a copy. Thank you, Representative Kaiser.
Okay. All right.
I'm sorry. I just came in. I shouldn't have said anything.
Ooh. Well, that'll teach you to be late.
Exactly.
I'm telling you, no, it's okay. All right. And we do have a representative that wants to say something about the bill. You over there? I'm sorry. I almost forgot you.
So is there going to be a substitute, or is this the language of the bill?
This is the language. So if you want to do something.
Well, thank you, Madam Chair. This all happens really fast, and this is just my second session, so I apologize for being a little bit late to the conversation in this, but the rural doctors have tremendous concerns because most of those rural ER doctors are certified through American Board Physician Specialist, not medical specialist or osteopathic specialist or whatever those other letters are. I had an amendment drafted to try to get someone to possibly consider asking the committee to look at.
Do you have that amendment with you?
Yes, ma'am, I do. And all it does is inserts into that an addition of American Board of Physician Specialties in addition to the American Board of Medical Specialties and Osteopathic Specialties. So what has happened, and the report that I'm given is very clear that the way the bill is written is it's more of a monopolistic type of a thing that will just narrow that down to just those two board certification groups, and that the American Board of Physician Specialties is one of the nation's leading certifying bodies for both allopathic MD or osteopathic DO physicians, and in rural Georgia, which is a battle we fight every day south of Macon, you're not going to get these other guys from these metro areas to come to Douglas, Georgia, Ocilla, Georgia, to practice the internal medicine docs that are going to be in the emergency room. So yes, ma'am, I do have an amendment, and just so that I'm clear, this would be an amendment that would be to the Senate Bill 385 that you have.
Would you let the senator see the amendment, please?
Thank you.
I'll take questions while he's looking at it. Mr. Representative Petrie.
Yes, ma'am. Thank you, Madam Chair. I have a question for my friend, Representative Laricchia.
Okay.
Have you had conversation with the Medical Association about this? Because I'm not as knowledgeable about the different boards, but that was key to all of this, was understanding which of these boards were, there's all kind of boards out there.
Yeah.
Some are very reputable, some are not. I feel like I don't know where we're standing until I hear from them, and I don't know if they're in the room, but I would love to hear their position.
If the intent is, and certainly I'm not questioning the intent of the legislation nor the senator's reason for introducing it, but if the intent of the legislation is to make sure a doctor's sign is reflective of what he's actually certified to do, that's a whole nother issue. We lock him up, put him in jail, take his board certification, you don't care what it is. I don't think the true intent of this is to make a doctor list out completely what he actually is certified in. That's a consumer issue. If I go to a dentist and I don't think he's got all those letters behind his name, I'll figure that out. My apologies, Representative Hawkins, but but this is and what they're trying to do, and most of the hospitals in Metro Atlanta aren't going to hire you if you're not certified in those top two medical specialists and osteopathic. In rural South Georgia, I hate to put it this way, but they'll just about look through the applications of whatever doctors will come through down there and work in their emergency rooms.
Veterinarian, yeah.
Okay.
Can I ask Representative Price to weigh in on this, perhaps?
And I have had conversations with with Representative Price about this.
And it sounds like it's similar to the substitute I had seen, I'm guessing, but I was not in favor of the substitute I saw. This sounds like sort of a meld between that substitute and this bill. And I'm not sure it achieves totally what we're trying to achieve, which is to
monopolize those two that are at the top.
No,
I don't think.
No, it's the point is you don't want someone claiming a board certification if it's very easy to obtain, i.e., you can go online and pay a small amount of money and answer 5 multiple choice questions or something.
If they put that on the sign and they're not certified in that, I think you're fighting a whole nother issue. Because if they put on their sign that they're American Board Physician Specialty, ABS or PS, then that's what they are. If they're putting American Board Medical Specialties, that's what they are. And so I don't think it changes what they put on the sign by adding this into this amendment of American Board of Physician Specialties. I don't think it changes what they put on the sign. If somebody puts something on the sign that they're not licensed in or certified in, you lock them up and remove their board certification.
Okay, I've got a couple more questions. Representative Peake.
Representative Peach may have asked it, but I think that led to the other question, Madam Chair, if I can. So you're saying there's a different standard in ability to obtain these board certifications than what Representative Ricky is saying of these other board
There are a
certifications?
number of entities holding themselves out to offer board certification with a variety of qualifications and standards.
Right, and
Okay, but Representative, I think, how does the amendment read, Representative? Or
It just adds into, it amends into that American Board Physician Specialties. It just adds that other board certification name into that.
so, Representative Price, it's not adding a bunch of different boards. It's saying one specific board. Do you know about that board? American Board of Physician Specialties? Okay. All right, let me go on to a couple, while my vice chair is looking up. Representative Kidd?
Thank you, Madam Chair. Gentlemen, the individuals you're talking about, are they MDs, DOs? What are they? Exactly
MDs
what
and
are, what
DOs.
license do they hold?
The rural doctors,
Yes.
MDs and DOs.
All right, if they're MDs and DOs, then they'd be board certified just like every other MD and DO throughout the state.
Yes, sir.
And so they would need to be certified by a board of physician specialists if they're still MDs and DOs. What this
I don't, Representative,
the original bill says MDs and DOs are certified by the American Board of Medical Specialists. And that's what they all are certified by.
okay, Representative, I think that, I think your board specialization, Representative Price, let's see if we get this right. You come out of medical school, whether you're a DO or an MD, and you take your internship, and you can practice medicine if you get your license in the state. Board certification, if it's my understanding, because my husband was board certified in family practice, was an extra test that he took every 7 years, which, even though he didn't do it, covered OB and peds and was very difficult, is an extra thing that you can or cannot do. Am I right, Representative Price?
That's correct.
Huh?
Licensure is something totally separate, and the state issues a license to practice medicine.
Right.
And it's recognized throughout the state. Should you desire to be board certified,
What?
that is an extra step that you
Okay,
take.
what's the-
Some hospitals require it, some practice settings require it. But if you did not have the board certification as indicated in this bill, this would not jeopardize your ability to
Okay.
practice medicine.
Okay, all right. How what? Okay, Marcus Downing with the Medical Association, would you like to comment, please?
If you like, I would.
Fine, okay, come up here.
Good afternoon, Madam Chair, members of the committee. I'm Marcus Downs with the Medical Association of Georgia. We represent about 8,000 physicians. I do not have access to the amendment that is being proposed. I will tell you this, that the original bill that Representative Price sponsored was something that was upheld at the MAG House of Delegates, where we have about 200 physicians that meet, and my understanding is that is an agreement with the AOA, the AMA, the American Osteopath Association, the American Medical Association, I believe the National Dermatology Association, as well as the National Plastic Surgery Association. That is an agreement that was made at that level. Obviously, it's also been upheld at the state level. During our House of Delegates, I'm trying to get to it, Madam Chair, I promise. During our House of Delegates, we also looked at another piece that would address looks like the amendment that is being presented here, or the substitute that's being presented here. We were asked to take a position on that. MAG is developing its position on that. And so, you know, I can say that we are on record supporting the original House Bill 826.
Okay. Okay, thank you. Representative Jaspers.
Thank you, Madam Chairman. Just following up with Representative LaRicchia, I think and tell me if this is the idea that in the beginning this bill seemed like it was a truth and advertising bill. Is that what you felt?
Yes, sir.
And now it seems like it's turning into one where one group can say that others are qualified. Is that what you're saying?
Yes, sir.
That's what I thought you were. So to limit
In
the access
particular,
to
how it
everyone.
burdens rural ER doctors, because there is a tremendous shortage of ER doctors going to South Georgia to work in these small rural hospitals. And if I hear one more time how we're going to address rural health care, I think I'm going to stab myself in the head with a pen.
Okay. Representative Reinders.
Turn on. There's a part of me that thinks that the process while we're trying to work through this is to go ahead and accept the amendment into language and let the Senate disagree with it, then they can work out the details of that. And I think that's the easiest way to resolve this at this particular time and in the interest. If the senator has a problem with it, then he can disagree to it, which is the process, and we can actually get down to it, and therefore we can see, and they have time to actually validate who's right on this particular issue. And so at the appropriate time, I just think we ought to accept the amendment.
Okay. Representative Price, do you have anything else to add to it? I had your light. I thought your light was on. Okay.
Thank you, Madam Chairman. I have not seen the exact wording. And I don't feel overly supportive.
Okay.
At this point.
And, Madam Chair, may I make one comment since the bill was called something that it's not? I'd like to just speak to that. It's not my purpose is not a battle. I introduced legislation last year, so this isn't the first time around. It's a different bill number. There are issues going on. I can repeat some in my own down Johnson Ferry Road, that this is a real problem in our communities, and patients are getting hurt, and this also would provide teeth to the Composite State Board that they testified in the Senate. If this bill were to pass, they would actually have the ability to enforce what they feel like they cannot always enforce.
Okay. Representative Henson, you get a very short question. I have to be at a meeting.
Just looking here at the American Board of Physician Assistants, they're the third largest nationally recognized physician multi-specialty certifying board in the U.S. They're across all 50 states, Puerto Rico, and they offer a path towards board certification for qualified allopathic and osteopathic physicians in 18 different specialties. Doesn't seem like it's a big problem adding them.
Okay, thank you. Representative Petrie.
I was going to quickly ask the senator if he could give us an example. You mentioned a lot of examples of this in your district. I'd like to hear an example of what kind of, I think it'll help all of us to hear that.
There are some, for example, and the term escapes me because I'm not a physician, but you can be doing plastic type, you're not a plastic surgery board certified in plastic surgery, but I think it's cosmetic surgery, and some of those.
The ear, nose, and throat people. The ear, nose, and throat people
Chairwoman's aware.
Are sometimes doing what other people think are plastic surgery. And I think that they're saying that there's somewhere that you can go get a little fly-by-night board thing and say you're, also certified in plastic surgery, but they're certified in EENT, but not that kind of thing. Okay,
Thank you.
I'm going to move, I think, Representative Reinders. Okay, what is the position of the bill? What's the thing on committee about the bill until we have a chance to amend it or not amend it?
Make a motion to pass as is.
Okay, we have a motion that do pass without, I don't think I'm going to recognize you for that. Okay, do I hear another motion?
Madam Chair, I'd like to accept the amendment if that's good with Senator.
Wait, I want to get a thing on the overall bill.
All right.
Do I have a motion on the bill? Okay, we have a motion to do pass and a second. Now, I will take amendments.
Thank you so much.
Possible amendments.
Thank you so much, Madam Chair. I just think in order to make sure that we gain clarity with the sponsor of the bill, I don't think finds what I'm suggesting problematic.
I prefer the bill as introduced, but I defer to the will of the committee, of course.
Okay.
I'd like to see it move forward as opposed to die.
I can't split that baby's baby, but we'll do it this way. We'll do it this way. I would like to see that we amend it with this bill. Hopefully the Senate will, if it's fine with it, we'll know, and if not, they'll disagree and it'll go to conference. So mine is to accept the LaRickia amendment.
Okay.
Second.
Okay, let me read for everybody where it is. On line 17 and 23, look at line 17 and 23, after specialties, on line 17, we would insert the American Board of Physician Specialties. It would be, that's it. And that would be on line 17 and 23. So that is the motion for an amendment. Do I hear that we move on? We have a motion that we accept and second. Everyone in favor of the amendment by Representative Reinders, raise your hand.
That's good enough.
Okay. Everyone opposed? All right. Okay, now the amendment passed. Now we have a motion to pass Senate Bill 385, and as it will be as amended. It will go out as a House substitute. We have a motion and a second. Is there any more discussion? Hearing no more discussion, everybody in favor of Senate Bill 385, as we've amended, to go out as a House substitute, say aye. Aye. Anyone opposed? No. Okay, the ayes have it. Senator, you're going to have to fight it out in conference or send it back over, reject, and let us.
Thank you, Madam Chair.
Thank you.